Okay. Good afternoon, everybody. Good afternoon and happy Saturday. It's a beautiful sunny day. I hope everybody can find some time to get outside this afternoon and enjoy the beautiful day. I want to thank you all for continuing to tune in at 1 o'clock every day. I try to provide accurate information. Well, we always provide accurate information, but I try to provide the most up-to-date information that's the most relevant for you and your families. I continue to believe that staying informed and educated and focusing on facts, not frenzy, is absolutely the best way to get through this. So I would encourage you, whenever you can, to tune in at 1 o'clock and make sure that you have the facts as they relate to coronavirus here in the state of Rhode Island. The cases are on the screen. As you will see, today we're reporting another 430 cases. So about the same as yesterday. That's good news. That is good news. We are in a plateau right now, which is an excellent thing to be stable. A few of you asked about our R0 the other day. You know, we're definitely getting closer to 1 than we were. So this is all good news, and I can't wait for the day when we start to see a decline. But the fact that we're plateauing and holding steady on cases and hospitalizations is a testament to your hard work, to your obeying of the stay-at-home order, and it should give you a great sigh of relief and a sense of confidence that together we are fighting effectively with the virus, and we're starting to see light at the end of the tunnel. Unfortunately, we have additional deaths, and Dr. Nicole Alexander-Scott will provide the details of those, but our thoughts and prayers are with those families, as this is such a difficult time. Today I have some happy announcements, some announcements that are intended to give us all a bit of a lift and a little inspiration as we kind of muddle through this day after day with this stay-at-home order. The fact of the matter is, so many people are struggling, and I hear from you every day, and keep sending me your stories. I want to hear from you. We're going to do everything we can to help you. I'm hearing from restaurant owners, hotel owners, hairdressers. Hang in there. We're going to get you back to work, and we're going to support you in the meantime. But one group that I mentioned last Saturday that is especially hard hit right now are artists, all kinds of artists, performing artists, graphic artists, dancers. They're really struggling. Art is a major part of Rhode Island's economy, and the fact is right now our galleries, our studios, our stages, they're all dark, and that means folks aren't working. And so I want everyone to remember that. One of the best things about Rhode Island is our arts and culture. We punch way above our weight when it comes to arts and culture in Rhode Island. And it's something I've always been proud of, and I know all of us enjoy and we're proud of. But right now, many of our artists are out of work. So last Saturday, I announced the formation of the Rhode Island Artist Relief Fund. And I asked you then, if you were in a position to give, could you please make a donation? And we're distributing those funds to artists who need a hand. In the last week, you've given more than $15,000 to this fund. Good job. Thank you. And we're already in the process of giving it out to our friends and neighbors who are artists. If you're one of the lucky ones, if you're still working right now, and if you're in a position to give in any amount to that fund, to chip in, to help support our artists to get through this time, I'd ask you to go to the website, www.artistcommunities.org, and search Rhode Island Artist Relief Fund. Rhode Island Artist Relief Fund, and you can make a donation. Anything will help. Anything will help. But I've heard from many artists who are grateful for this, and I want you to know we're going to keep raising money and keep putting it out the door so we can keep supporting you. If you're a local artist who needs support, you can go to the Rhode Island State Council on the Arts website, which all of you know. It's risca.online, and you can apply for funding. Now, it's also no secret that art can be a source of comfort and hope and inspiration. And I think we could all use a little bit of that right now. There's not a person out there in Rhode Island who isn't struggling some days or every day, and in our own ways. and we could all use a lift. And art can play a wonderful role in our lives as a way to express ourselves, as a way to connect with other people, as a way to find inspiration and hope, and to be creative. We have to be resilient to get through what we're going through, and creativity is a part of that resilience. This whole exercise of what we're doing is an exercise in adapting. And by the way, we're going to be doing a lot of adapting for the next year. We're going to be pivoting and weaving and adapting because we're living with this virus. And by the way, we're going to do it. We are doing it, and we will do it. We're going to live with it. But creativity and hope and art can really help us to get through that. And what better place than Rhode Island to kick off an arts initiative in order to connect us all and help us get through it. So today I'm announcing an initiative for all Rhode Islanders to connect through art during this difficult time. I've been telling you to stay at home for weeks. Now, I don't want you to be isolated, but it's hard not to get isolated. So let's get together with art. I'm calling on all Rhode Islanders, that means you, whoever you are, I'm calling on you all, of all ages, to create and share family-friendly art with the rest of us. Any kind of art, drawings, poetry, songs, essays, photographs, videos, any preferred medium. Be creative. And anything that's inspiring you during this time, or any feelings you have, or anything you want to share. To share the artwork, I want you to take a picture of it, or make a video, and share it on social media with hashtag RIArts, RIArts. And we want to hear from everybody, and everybody. If you're a professional artist, great. If you're a student, if you're a senior, if you're not a particularly artistic person, but you have something you want to share, everybody. It's a great opportunity to get your creativity out there. Creations can also be submitted via email or in the mail to the Rhode Island State Council on the Arts. You can go to their website for more information. By the way, huge shout out and thank you to Randy at the council. You're terrific, and I appreciate you for doing all the legwork that's been required to make this happen. Today, I'm also launching a new website. The website is called riarts.org, riarts.org. If you're an artist, you can go to this website to get connected with all of the resources to support artists. If you're somebody who's missing the arts or just want to turn to the arts right now, you can go to this website and get an up-to-date list of all the performances, music, film, theater, that are going on virtually all around the state. Again, just go to riarts.org. I think you'll be surprised at how much creative activity is still happening virtually, and I would encourage you all to enjoy it. I want to thank Infosys, which is a company here in Rhode Island. It's actually a new company. We recruited them here a couple of years ago, and from the minute they opened their office in Rhode Island, they have been model corporate citizens through their philanthropy and charity and community engagement and volunteerism. Infosys volunteered time to work with the Rhode Island Council for the Arts to get this online effort and website organized. So thank you, Infosys, for doing that and for all the ways that you're helping us through this crisis. Now, I have one more announcement related to the arts, and this one I'm especially excited about. And it begins from me with a huge thank you to an artist, Shepard Ferry. Shepard is a RISD graduate. Many of you probably know Shepard. He was here a few months ago with a mural exhibit. He became quite famous with his Obama imagery, the hope imagery. He's a RISD graduate, so we can claim him as one of our own. He's a renowned artist and founder of the Obey brand for creating a beautiful and inspirational image. He's calling the image Rhode Island Angel of Hope and Strength. So hopefully you're seeing the image right now on your screen, and I hope you agree with me that it is beautiful and it's inspirational. I called Shepherd about a month ago, and I asked him if he would consider donating his time to create us a hopeful image, because I think we could all use a hopeful image right now. And he did exactly that. I love it. It's Rhode Island. It's hopeful. It's a young woman. So many of the people who are frontline healthcare workers right now are young women. And it's a show of strength and resilience. And it's something that I think we can all really appreciate. It's also a great nod and show of appreciation to all of our first responders. So many people have continued to go to work every day. First responders, people in state service, doctors, nurses, therapists, all frontline workers. Even think about the cleaning people in the nursing homes. They haven't gotten a day off. They're out there every day keeping us safe. And often they're afraid to go to work, but they do it. And I'm proud of you, and I'm grateful for you, and I admire your bravery. So this is for you. This is a thank you from us to you, and this is for all of Rhode Island. It's time to be brave. It's time to be strong. It's time to dig deep and get through this together as a community. And I have always found that a hopeful image is a way to galvanize and connect one another. I would like to say, without hesitation, Shepherd agreed to do this when I called him. He didn't say, let me think about it and I'll call you back in a few days. He said, absolutely, I'm an honorary Rhode Islander. I'm so fond of my time at RISD, and anything I can do to help out, count me in. So Shepherd, thank you for this image, and I think you nailed it. I love it. The image is going to be available for free downloads on rhodeislandarts.org, so you can carry it with you. You can turn it into a screensaver. You can, put it on your phone, your computer, print it out. I know some people have said they're going to print it out and put it in their window. We're trying to get some of the local print publications to print it in the paper. But I hope it's a way that we can come together. Lastly, to help us spread the inspiration of Shepherd's image, his alma mater, RISD, will be projecting the image on 2 buildings starting tonight at 7:30 every night for the next week. One location is on the Market Square side of the RISD Auditorium, 17 Canal Walk, and the second location is on the back of 20 Washington Place, which is visible along Steeple Street. And I'd like to thank Roseanne Summerson, the president of RISD, and her teams for their generosity in doing this and for making this happen. So I'd encourage you to all go check it out. Don't congregate. Please do not form a crowd to check it out. But it's there every night, all night, starting at 7:30 for the next week. So if you have a minute, drive by, take a walk by, and say thank you to our first responders, and I hope you find some hope and inspiration in this unifying image. Okay, a couple more announcements. I want to talk for a minute about what's happening in the Latino community and the fact that 45+% of all of our cases are in the Latino community. This is, to say the least, deeply concerning. It is deeply concerning. And we're working hard. We're doing a lot to reach the community, but clearly this is an alarming statistic and tells us that we need to do more. And I want you to know that I'm deeply committed to continuing to work on the issue until we figure out exactly why this is going on, what is it happening that leads to this, and until we do a better job to mitigate it. We're taking some steps. We've taken steps already. We've had my staff, and members of my cabinet have been calling into Spanish radio on a daily basis every day from the beginning of the crisis to ensure that key messages are being shared with the community around issues like unemployment insurance and testing and small business loans. We're translating as many materials as we can into Spanish, the daily press releases, state agency websites, critical resource documents. Starting yesterday, we have started a new advertising campaign on Spanish radio and social media designed to just get public health messages out and into the community in Spanish. These daily press briefings are translated, obviously real time, and available for live broadcast by all Spanish radio stations. And the Spanish language recordings of the press conferences are set out each afternoon. As of this week, the full videos of these daily press briefings are available on my Facebook page in Spanish, and those go up every evening. So that's what we're doing. But clearly, that is not enough. So that's not all we're going to do. This Tuesday at 7 o'clock, I'll be holding a Facebook town hall with Commissioner Infante Green so that we can answer your questions. This will be primarily focused on education, obviously conducted in Spanish, but I'll take any questions. We'll take any questions that you have. And of course, the Commissioner will answer any of your questions related to distance learning and the fact that we've had to close schools till the end of the year. You can check out RIDE's Facebook page this weekend for more details. I also want to take a minute to thank the Latino community leaders who have agreed to serve in an advisory capacity to me. We had a terrific meeting yesterday, a virtual meeting, a phone call, and I was able to hear directly from the community what is going on the ground in the neighborhoods that are most affected and what we could do together to do a better job of addressing the public health needs of the community. And rest assured, we're going to get to work on that list, and I can't thank you enough. We are going to meet continuously. Courtney Hawkins, who runs DHS, is going to lead that effort, and I can't say it enough. The more we communicate, the more you let us know, the better we can be, and I will continue to be flexible with our response so that we can respond to the needs as they arise. Finally, I just want to remind everybody that the stay-at-home order is in full force and effect. It's a beautiful day outside. We all have cabin fever. I can well imagine everybody wants to go outside, wants to congregate, maybe wants to invite friends over for dinner. I'm asking you please not to do it. Hang in there with me just a little bit longer. If I thought it were safe, if our public health experts thought it were safe, I would lift the stay-at-home order sooner. But the fact of the matter is, it isn't. These past few days, we have seen glimmers of hope, just in these past few days, which means don't blow it this weekend. Don't blow it when the weather gets nice. Hang in there just a bit more. If you want to go for a walk today, fantastic. If you want to get some exercise outside, great. Obviously, if you have to go to the grocery store, run an errand, fine. But remember, the stay-at-home order is in effect. If you're sick, you absolutely have to stay home. Our testing sites are up and running today, so I want you to go get tested if you need it. Absolutely, under no circumstances can there be any social gatherings of any kind greater than 5 people, period, end of discussion. It's tough. It's a tough message. It's a tough time. And very soon, I'm going to be at this podium saying great news. We can congregate in larger groups. We can leave our houses. We don't have to stay home. But just right now, a bit longer, hang in there. Your hard work is working. And if you do this, and if we get through this weekend and this week, it's going to make it so that I can return us all to work and normalcy that much sooner and, frankly, that much safer. Because we're learning the hard lessons from other states and countries around the world that when you jump the gun before you're ready, the consequences are terrible. So enjoy the day, enjoy the weekend, but please keep up your vigilance and discipline, because we're at a really important point right now, and I want to make sure we bend the curve, start declining, so we can all get back to business. So with that, I'll turn it over to Dr. Nicole.
Thank you, Governor. Good afternoon, everyone. Happy Saturday. It is a beautiful day, so I want to echo what the Governor has said in reminding everyone that if you are going outside today, to please be safe and be responsible, knowing the stay-at-home order that's in place. So what that means is maintaining a distance of 6 feet from other people. It means wearing a cloth face covering. And I'll also remind again, being mindful of the environment and things like ticks that are in our environment. So just being safe overall and taking preventative measures. Some of the prevention messaging I shared the other day pertaining being mindful of ticks is to avoid wooded and brushy areas with high grass and leaves. And if you are on a trail, walk in the center of the trail to stay away from the edges where there are high grass and leaves. Also, if you're going to be in an area with high grass or on a trail, do a full body check for ticks when you get home. And of course, if you see a tick on your body, remove it with a set of tweezers right away. Those are core prevention measures that you can take and is one example of many that we want to continue to highlight and make sure that you have as tools in your toolbox so that we can all continue to be safe through this. In terms of our COVID-19 data, we have 430 new cases today. That makes our case total 7,129. I want to use that to also give kudos to our comprehensive testing system that is in place. All of the laboratories involved, including our state health laboratories at the Rhode Island Department of Health, all of the people involved with swabbing, all of our respiratory clinics, all of the providers who are helping CVS. It is tremendous. Yesterday, as a state, we did a total of 3,600 tests and more yesterday. It's far surpassing our initial goal, and it's what contributes to our ability to be able to identify people with COVID-19 so that we can work quickly towards connecting with them, getting them into the support that they need to isolate appropriately, and identifying your contacts, continuing to keep track of who contacts are so that as soon as a test is obtained, you can give your contacts, either in your household or your close friends, a heads up to know to start to prepare for staying home and quarantining to monitor themselves for symptoms as well. We know that those are the key ways for us to stop the spread of this virus, and our expanded testing is helping us identify more and more of that so that we can get people into the appropriate quarantine and isolation steps that are needed to stop further transmission. Also, unfortunately, I want to share more about the 13 new fatalities that have occurred as well. One of the people who passed away was in their 60s. One of them was in their 70s. 8 of them were in their 80s. 2 were in their 90s. And one beloved person was older than 100 years old. 10 of these people were nursing home residents. As always is important, our deepest sympathies go out to these people and their families. This is a difficult time for all of us, but it is most difficult for people who have lost a dear loved one. To these families, please know how sorry we are for your loss. I want to return to a topic I've hit upon once or twice in the last few weeks, which is the need to continue to seek routine medical care. We want people to stay home as much as possible, knowing that is the key way to stop transmission. But doctors' offices and other healthcare providers are still taking care of their patients. Many opportunities to get health care are available now as things have changed and evolved to respond to our needs. Some in-person visits may not be able to be put off and should not be put off, like appointments for immunizations. There are other visits where it is acceptable to participate in telehealth and to have a phone call with your provider. The key is to make sure that routine medical care continues during this time. If we look more at immunizations as an example, which we absolutely want to make sure that people continue to receive as they need it, taking a very preliminary look, we know that our immunization rates for many vaccines are down for last month. COVID-19 is real, and COVID-19 can be dangerous. But measles can be dangerous, as well as pertussis, and varicella, and influenza, and other diseases. These illnesses can make children very sick very quickly. Routine care for children and adults is very important to maintain through this time. We want to really make that message clear to everyone. Emergency care is also important. A reporter asked an important question the other day about whether we are seeing an increase in amputations because of delayed medical care. As I've shared, and I can verify, we haven't seen any data that suggests that specifically, but we are hearing from the hospital community that people are not going to emergency departments. Emergency departments are open and safe and are ready to treat people who need emergency care. If you are having COVID-19-like symptoms, as we have been saying, we want you to call any healthcare provider or any healthcare facility first. Let's talk about what those symptoms are. It's fever, cough, shortness of breath, muscle aches, chills, runny nose or stuffy nose, sore throat, headache, nausea, vomiting, or diarrhea. Those are symptoms, any one of them, that if you're having, you should call your healthcare provider, call an urgent care center, call a healthcare facility where you can get assistance and get referred for testing, which we want to continue to encourage, particularly for people who have symptoms. But I also want to talk about what happens if you are experiencing a genuine medical emergency. We want to make sure you know it is important to get emergency care right away. That means you should either call 911 or find another way to call and contact an emergency department. Your healthcare provider can help with that. An emergency department can help with that to access emergency care immediately. That's something we want to make sure you know is available to you and that you should if a medical emergency is needed. Here are examples of some medical emergencies. Chest pain or pain that moves to the arm or neck that's consistent with possibly a heart attack. Severe bleeding that won't stop. Broken or displaced bones that have happened acutely that you need to get addressed and are experiencing severe pain. A severe burn that happened. Those are examples of where you should seek emergency medical care. And we want to support you in being able to call and figure out the best way to access that care. As I've said a few times, COVID-19 certainly is a statewide public health crisis right now. But we also still need to take the steps required to keep ourselves healthy and safe when it comes to our other health issues. We do not want to just push them aside and cause concerns that would be even worse than or equal to what we are facing with COVID-19. That's an opportunity where all of us can play our own role in taking care of ourselves, our families, and our community. This is an important message, so please make sure that you help in sharing this with your family and friends as well. And so with that, I want to get us started with questions. Thank you.
Good afternoon.
Good afternoon. Thank you.
Our first question is from Ryan Belmore of What's Up Newport. What information, data, or trends is giving or will give you the confidence that lifting the stay-at-home order on May 9th is the right and best decision to make for everyone's health and the economy?
So it's a great question, obviously, because it's a very difficult and significant decision. I will highlight that on Monday of this week, I plan to dedicate the majority of the 1 o'clock press conference to addressing exactly this issue. But I will give you a preview of that now, and it's the same thing I've been saying all along. You know, in an ideal world, we would see a trend of decline in cases, decline in hospitalizations. I have metrics around making sure that we're ready for a potential surge if it comes. So how many tests are we doing per day? How quickly can we do contact tracing? And how completely can we do contact tracing? Have we stabilized the nursing home and congregate care, healthcare situation? So last Monday, I went through the 6 principles that I would apply. And this coming Monday, I'm going to give more information. But it'll be a combination of factors that tell us, have we passed our peak, and are we beginning to see a decline or at least a long-term plateau? And also, is our healthcare system ready? Is our society ready? Is our business community ready? Do we have enough personal protective equipment? Are we ready to safely reopen? So that's a preview for now, and then we'll talk more about it next week.
Our next question is from Michael Bilo of Motif Magazine, and this is for Dr. Alexander Scott. Wyatt Detention Center, a congregate care facility, told the federal court yesterday they have 8 positive detainees and pending test results for 7 detainees and 10 staff members. They said they are working with the Department of Health on testing and contact tracing. What exactly is the Department of Health's involvement?
Thank you for that. The Wyatt Detention Center did have their first case earlier this week. They have a group of cases now between 5 and 10. And our state epidemiologist has been in touch with the medical director at the facility every day since that first case was identified. They have a plan in place to isolate patients who are ill and to prevent transmission. They also have a negative room unit, which is a space used in hospitals and medical centers to prevent cross-contamination from room to room. And there are challenges associated with moving patients in a correctional facility, but facilities have plans in place to manage difficult medical situations like this. We are testing the staff in the facility, and we're actively supporting the facility in their management in this situation.
Our next question, Governor, is for you from Tanya Signori of the Rhode Island Echo. How can local thriving businesses or local philanthropists contribute to the Rhode Island Small Business Association? Is it an easy enough process to have a foundation set up?
So thank you for the question, and it's good to know that people are in a position to be able to give. I would direct you to 2 possibilities. When we first began this, the Rhode Island Foundation set up a coronavirus relief fund, and I have been working very closely with the Rhode Island Foundation to make sure that that is, being allocated to our greatest needs as we fight together the crisis. So that's an excellent place that I would direct any corporate or individual giving. Some of it is going to small businesses, others of it to social services and food, et cetera. So that's the Rhode Island Foundation. Additionally, you could go to the Commerce Rhode Island website. I would encourage you to do that. We are setting up a number of small business initiatives to help small businesses. We're providing technical assistance, as I've mentioned. We're providing small business loans. We're soon going to be providing rental assistance for the lowest income Rhode Islanders. So I would very much appreciate hearing from any companies who are in a position to give call Commerce Secretary Pryor, call the Commerce Department, go on Commerce's website, and let us know how you can help.
Tony Pother of 102 FM asks, can you share data on the number of COVID-19 positive cases from workers in factories and industry settings?
Thank you for that, Tony. We have shared that Taylor Farms and Danielle are the places where we are currently seeing the large groupings of cases outside of nursing homes. We can continue to look into data on those who are working in factories and industry settings. There are businesses with groupings of cases, but they are much smaller. We would definitely make an announcement about any workplace concerns that impact public health in terms of the risk of spreading infection, but there are no other workplaces that have that at this point. And we want to continue to use the information that we're using to help guide our outreach to communities where many of the people are from who work at the various facilities. So we appreciate the essence of your question, and instead of actually sharing business by business, unless there's a large group of cases or it has a public health implication that's important for the public to know, we want to use the data to help inform our conversations with the Latino and immigrant community, for example, and how to inform the strategies we have in place for expanding testing and the supports for services into our communities of color and those that are at highest risk of transmission.
Governor, the next question is for you, for John DePietro. He notes a record number of people have filed unemployment. However, not one state worker has been laid off, furloughed, or taken a pay cut. He asks, how is this fair to the majority of taxpayers? What about part-time lawyers for the General Assembly, which is not even in session?
Yeah, so thank you, John, and I hear you. Listen, through this, I have asked every employer who is in a position to not lay off their employees to do that. And most big companies have not had layoffs. And so I'm trying to follow the same advice. As long as we are in a position to avoid layoffs, I want to try to do that. We may get to a point where layoffs and furloughs are inevitable. In fact, that's, obviously probable in light of what our deficit is going to look like. But the last thing I want to do is to contribute to the state's unemployment problem and to lay people off. What we are doing is redeploying as many people as possible to serve the crisis. So we are, for example, with contact tracing. Contact tracing is very labor intensive. So we're taking folks who used to do something else and we're putting them onto contact tracing. In a way, that actually saves the state money because I don't have to go out and hire an outside firm, and we can use our state employees. So we're doing our best to do the right thing and keep as many people employed as long as possible, and we're trying to deploy people to fight the crisis. I will say that my ability and Director Smiley's ability to delay furloughs depends totally on the flexibility of the labor leaders, the public labor leaders, and the state workforce. And as long as they are willing to be flexible, I'm going to do everything I can to avoid layoffs. As it relates to the General Assembly, you'd have to ask them. That's something that they operate on their own. Anything to add? No? Okay.
Next question is from Kathy Gregg of the Providence Journal. I'll ask it in stages. Moody's says state has taken at least a $630 million revenue hit. What actions are considering to compensate? Tax hikes, which ones? I'll continue. Freeze on car tax phase out, fast start on legalizing marijuana.
Unlikely to do the last one. And beyond that, everything's on the table. So it's going to be a brutal budget to balance. By the way, that's true for every state in America. Before we can get to the business of balancing a budget, we need to know, the legislature needs to know what's going to happen with the next stimulus package. President Trump has thrown his support behind an additional federal stimulus for state governments. And our federal delegation, with whom I'm in touch every day, is strongly fighting for that. In fact, just this week, I talked to all 4 members of our delegation, and that is top of their list. So for the next 4 weeks, we are fighting the crisis. We have a sprint of work to do in order to safely start reopening the economy, which, by the way, is a heavy lift. Enough spaces for people to quarantine and isolate, even if they're home insecure. Enough places for healthcare workers to live if they feel it's unsafe to go home. A lot more testing in vulnerable communities. It was a long list. So we're focused on that. We're going to let Congress do its job and do the right thing and send a stimulus to states. And then in a month or so, we'll get to work with the legislature to do the hard decisions. And there will definitely be cuts. And there may be increases. And I don't know what they are now, and I'm not going to know until I have a clearer financial picture. But it's going to be hard. I can't sugarcoat it. There'll be no easy way out of it.
Next question is from Bruce Newberry at WADK Newport. Would you address a statement made today on national media for a moment? A national radio show host on which I was a guest today called you and the state out for keeping New Yorkers and Massachusetts residents out, and that is why we're doing better than other states. By the way, I had your back, Governor.
Well, that's good to know, Bruce. I appreciate that. That was a tough decision that I had to make, and I think it was the right decision. Because if you look, for example, if you look at other countries that had their virus under control and then it surged again, in almost every case it was related to inflow. The border wasn't secure. You know, I've mentioned Singapore numerous times. They were migrant workers. Or Singapore also announced, they said, we're going to close the border. And right before they closed the borders, there was a rush of people coming back to Singapore. In Hong Kong, it was related to college students coming back. So it matters. You know, it matters. Our very first cases here were folks who had been to Italy and come back. So there was a lot of excitement when I made that decision. People are welcome to come here. Absolutely, certainly. If they have family here or a second home here, we want them to come here. But it has to be done safely. When they come, we want to know they're here, we want to know where they are, we want to know that they're in quarantine, and we want to know that they're following the rules. And if they're positive, they need to be in isolation. So it's not about keeping people out, it's about letting them in safely and having the information that we need in order to keep the rest of our community safe. That's my job, to keep all of Rhode Island safe, and sometimes that means making tough decisions.
For folks at home, you might be hearing the noise in the distance. Eli Sherman notes that people are protesting outside the State House right now for you to reopen the economy. Some don't appear to be following your social distancing mandates. What's your message to them?
I certainly respect their opinion and their ability to protest. That's a great part of America. If they are violating the social distancing rules, then they should knock it off. As I've said many times, it's not helpful, it's not healthy, and it's putting them at risk and their families at risk. And at this point, to violate social distancing rules, it's just selfish. Look around. 180,000 people have filed unemployment insurance claims. We report on mortality, we report on mortality every day. Rhode Islanders are struggling. It's not a time to be selfish. It's a time to ask yourself, what can I do to help? And right now, what you can do to help is follow the rules so we can keep everybody safe and so we can get everybody back to work. I can tell you this, if everybody today went out and violated the rules, I will definitely have to push back the date at which we can reopen the economy. This is just a fact. This is a fact. We know with certainty that when mobility increases, there's more cases. Now, also, we're ready for it now. We have more testing, we have more hospital beds, we have more, equipment that we need. So I hear you. Listen, I want to get you back to work too. I don't want to keep anybody out of work for a minute more than they need to, but I'm not going to do it in a way that is unsafe or that I think, takes us backward to where we've been. And I'm not going to give in to my emotions, however frustrated that I might be, that we're all sick of staying home. So I'm sorry if you're frustrated. I get that. I love that you're playing a part in democracy, but do it in a way that is safe and obey social distancing, because otherwise you're going to wreck it for the rest of Rhode Island, and we all want to get back to work as soon as possible.
Kate Walsh of WPRI Channel 12 asks, with local food processing facilities having many cases of coronavirus now, what can you tell us about food safety? Would there be a risk of COVID-19 living in meat and other foods?
Yes, it's an excellent question. From what we know right now, COVID-19 cannot be transmitted through food. CDC, FDA is continuing to assess that. They've gone so far as to not recall any foods where there have been cases of COVID-19 in the food processing facilities. But it is something that we're continuing to assess. And for every work environment, we want to support those facilities in being able to implement the practices needed to stop the spread of transmission, allowing for cloth face coverings, supporting social distancing at least 6 feet where it's possible, making sure that people have access to hand hygiene, helping to ensure that environmental cleaning rules are, or guidelines are being followed in those facilities so that we can make it as safe as possible for people in food processing facilities, offices, or other areas where the public engages. All of these are steps towards our new normal.
Thank you, Doctor. The last question today for the Saturday briefing is from Steve Clampkin. We're told some foster parents are unable to obtain milk, diapers, and other needed goods. What, if anything, is the state doing to help the foster families?
So thank you for sharing that, Steve. And I will absolutely this afternoon look in on that again, because that's heartbreaking. We're doing a lot. As you know, we petitioned the federal government to allow for additional money to be on food stamps, and that has started. We're the second state in America to allow for that. I've been helping the food bank to raise money, and they're working double overtime to distribute money. DCYF is doing its very best to be in touch with foster families. We've raised money to help family service so that they can provide basic necessities, as you say, milk and diapers. But if you're hearing that, then we're not doing enough. If you're hearing that, then I take it seriously. We'll look into it, and we'll do even more.
Thank you, Governor.
Yeah, enjoy the day.